So let us start today's session. And guys, we are going to be doctors. We are doctors. Our body is made up of multiple organs, and no two organs behave or function independent to each other. For example, if the liver goes away, even as undergrad students, you know that if the liver goes away, the kidneys are going to get damaged. We call that hepatorenal syndrome. If the liver is damaged, the brain doesn't function, which is called hepatic encephalopathy. So even if you have a small abscess in the finger over here, you feel unwell, you feel totally down because of all the noxious prostaglandins and the toxins which are liberated. So the point I'm trying to make is, if your organs are mined together, if your entire organs and systems are fused together, why not these three faculties? So arts and commerce and science, are they really different? Are they perceived to be three different branches of life? I strongly disagree, because I really feel that these three, even though they appear to be eons apart, are nothing but the same stem cell. So for example, very few people know that top scientists like Albert Einstein or Newton or Ulrich Alva, they were extremely good pianists and violinists. A great statesman like Winston Churchill has got 500 portraits to his credit, and it's a very less known fact that an out-and-out statesman like Winston Churchill, who won the war for Britain, has actually got a Nobel Prize for literature. And can anybody forget the best possible painter in the world, Leonardo da Vinci? He was the A1 scientist. So many people don't know that way back in 14th century, he actually went, he dug up graves and he dissected bodies. And the sketches which he's made are existing even today, and people rate him as one of the best anatomists ever. So was he not a scientist in spite of being an artist? So the point is, art and commerce and science can never be differentiated from each other. If we are sensible, we'll incorporate everything in such a way that we have a great life ahead. So medicine is an art that has to be scientifically practiced within commercial boundaries, but while respecting legal parameters. So as far as I am concerned, there is no dichotomy in this situation at all. How to fuse a dry subject like medicine with interesting things like art? How to incorporate art into daily life in such a way that the commerce is respected and we fear law will be dealt with in the next couple of days, couple of minutes now. So you know what? Your 7th semester, 8th semester, 9th semester, some of your interns, Dr. Reddy, Dr. Nagendra, I've been in the practice for a long time. We'll all agree to one thing, that this tip is what we come out of medical college with. Believe it, this is only the tip with which we are really taught and we come out of medical college. This whole thing is under the water, and this is where we discover it to ourselves when we enter the big bad world of medicine. Am I correct, sir? So this is exactly what we have to actually come, and this comes with practice. This comes with blood and sweat and tears. Nobody can give it to you. You have just to get exposed, you have to work your backside off, and then maybe you will get this. Most of people never reach over here. Maybe even if you somewhere over here, you will be looked upon society as a fairly good doctor. But well, that is where it is. And so in the next couple of minutes, fusing art and science and can we be better doctors is going to be what we are dealing with. Very unfortunately, guys, you are going to inherit a medical practice which is really bad. So when I started practice way back in 1990, the medical practice or the medical legacy which we inherited was bad enough. So that was when the medical legal problems had just started coming in. Before that, you'll be amazed, doctor was always a god. Doctor can do no god, no wrong, nothing, he can never make errors. But in 1990s onwards, people started saying, what the heck are you? You are going to, dash up my case, so we are going to sue you. And unfortunately today, the situation is so bad that by the time you guys come into clinical practice, you'd better watch out, things are going to be disastrous. Most importantly, forget about the medical standards falling. The worst thing is this: people have unrealistic expectations out of a doctor. It is so difficult expecting and fulfilling their demands. How does one overcome this problem? For the simple reason, the whole perception of a patient who comes to a doctor is, we are entitled to immortality, we can never die, we are Amar. But it is you people who gave us the illness, and when we came to you, you probably made it from bad to worse. and there's not an iota of exaggeration in what I'm saying. Things are particularly good in India, at least. You go to West, you go to England, you go to America, there are something called ambulance chasers. Have you heard of this term, ambulance chasers? They are lawyers. There are lawyers who actually sit outside a doctor's chamber, and the minute a patient comes out, the lawyer instigates him or her. Were you happy with the doctor? Was he good? Did he have any problems? If not, this is my card, call me, we'll sue him together. And whatever damages we get, I'll keep 10%, you keep 90%. This is no exaggeration. I have a secretary in Apollo who has been working in US, and she says, doc, this is what happens. So the doctors in fact hired a couple of bouncers to throw the lawyers off. So this is the way it is, and we'd better be aware of how things are going to be in the years to come. This is a classical perception of how a patient looks upon a doctor. Look at that, all skepticism. Really? Are you sure? Really? Are you out to fleece me? Are you competent? So look at the expressions of the face. And of course, they want to get better, but they don't want to pay for it. That is the worst thing. So they want the services of something like a Taj or an Oberoi, but they want to pay for Ram Bharosa Hindu Hotel. That's it. So they don't want to pay. At the same time, they want good practices. And worst, they don't deserve payment. Their whole couch potatoes, the whole generation, people are getting obese, people are getting fatter day by day. They don't want to exercise, they don't want to do anything, and they want health. The tragedy with non-communicable diseases like diabetes and blood pressure and cholesterol is people are unaware of it. So your sugars may be 500, people are grossly unaware of it. Blood pressure may be 220 by 120, people are not aware of it. There are no symptoms as such. Cholesterol may be sky high, and then one fine day when the last straw breaks the camel's backs, they come charging to a doctor and they say, cure us. So who's going to tell them that whatever you're having right now has been accrued after decades of problems? But they don't understand that. And of course, our biggest problem is this. So I have had people who come to my clinic, and when I make a diagnosis, and then come out with a Paurav and Pandit, like they know everything. So doc, what do you think about this protocol? What do you think about that guideline? Within 10 minutes they wait outside and they search the entire Google. So this is so dangerous. Now this whole trend of Google Baji is getting to be a problem for us. This is what society expects us to be, supermen. They want us to be supermen. They want us to deliver like supermen do. Alright? And that is why the problem is we fall short. We are not Superman, Batman, we are not Flash, no way we are going to be that. But their expectations are sky high. And that is the reason why nowadays more and more of us are finding ourselves in the docks. More and more of us are finding this problem of litigation, and having to pay for something which you may or may not have done really hurts. And you know something, it's not even a question of paying, it's the process of going through that medical legal litigation, the anxieties, the stress, the humiliation which really kills. And I don't even mind paying money, but this is what happens. A prosecution by public trial. So you are hauled in front of the press and you are asked questions. Worst, your name is splashed in the papers and you are not even given a chance to defend yourself. You think this is an exaggeration? It is not. It is not. It's time all of us woke up to it. And the whole idea of today's thing is how to fuse brass tack common sense, how to infuse art and technique and shrewdness and delicacy and diplomacy in seeing to it that we don't land up in this position. You know, even this is not bad. What is particularly bad is this. You must have seen on your WhatsApp messages. How many doctors get bashed up every day? Plenty. And this was a very disturbing survey which was done. So 44% of people have been abused verbally, 5% physically, 22% both. You think this is an Indian phenomena? It's not. I was in Cardiff University in England, and वहाँ पे even the Gore professors were telling me, this is a problem here also. People come, they catch us by the collar and they push us around. It's a global phenomena, but particularly bad in India because the law is not with us. So every once in a while we get a message of some doctor having got a CAW or somebody having been bashed up or something. So far things were bad because non-medical person were attacking us. Now things are so bad that even doctors are attacking us. How many of you have heard of this book? This book was released exactly 2 months ago. It's been written by a doctor from Mumbai. And the name of the book is Healers or Predators? Healthcare Corruption in India. This book was released on NDTV by none other than Mr. Pranoy Roy. and this was a very disturbing 1-hour documentary. I've seen it and it was disgusting. The book claims that 85% doctors in India are corrupt and the remaining 15% are incompetent. Can you believe it? And see the way they have projected the facts and the figures and the slant to the book, written by a doctor himself. I mean, it's what I think it's perverted. That's all I can say. But this book is being read by people even now as we are talking, and this is the impression with which people are going to come to you 2 years down the line, 3 years down the line, when you are going to start practice. So we'd better push up right now. And no wonder that being a doctor now is so difficult. It's almost like a hangman's noose. The stethoscope is not a stethoscope nowadays, it's a hangman's noose. It is so dull, it is so depressing. So, is this really the final word? Are things really that bad? Can we not change the world a little bit? Can we not have the cake and eat it? It's possible, and that's what we are going to address today. However, it is as difficult as this. Balance is the key to life, fine, but it's theoretically so easy, but technically rather difficult. But it can be done, why not? So the next two quotations are really good, and that's what this is, Medicine is a science of uncertainty and an art of probability. We have to get this quotation bang inside our grey matter over here. We have to understand that what Osler was saying some 3 centuries ago is really the truth. Medicine is not medicine. 2 and 2 doesn't necessarily make 4 every time in medicine. It doesn't. Especially in a field like mine, in internal medicine, it's like playing mental chess all the time. Dr. Nagendra will agree with me. It is not an anatomical field. Like, you see a retina, you stitch it, you see a fracture, you put a nail across it. No, it's not. So, we have to somehow fit that probability into uncertainty, and we have to make it a great life for the patient and thereby for us. And the next great quotation is from Einstein. So, after a certain high level of technical skill is achieved, science and art tend to coalesce in aesthetics, plasticity and form, which is so beautiful. So this is the quotation with which I go by. It says that once you have perfected your knowledge, you have to bend, you have to adjust in such a way that you impart that knowledge to the person in front of you with a superb technique. So in other words, there is a very good quotation which says, a diplomat is a person who, when he tells the patient to go to hell, the patient looks forward to it. So the idea is to make your presentation, the idea is to make your science so palatable, so presentable and so alluring that the patient in front of you, the relatives, are just going to get sold over you. So let us start today's section by 1, 2 and 3. Alright. So the first 3, I have been given quite a lot by God, thoroughly undeserving as I am. And I am so humbled by it. I have been given a great practice, I have been given a very good platform to work in. I have no complaints. I have been there, I have done that, I have whatever I wanted to do. Now I am in the dawn of my career, and it's my earnest and passionate belief and my desire to share whatever I have with new students, with new generation of doctors. And that's why I have flown over here 800 kilometers from my house. So the idea is not that I know everything. The idea is to share something, to get something from you, which is what life is all about. So I have been very passionate about making these slides, and I hope that enthusiasm and that passion is reciprocated from you all. Secondly, I have incorporated a lot of clinical material over here. Actual day-to-day cases have been given over here. I shall be flashing the clues, and I want you guys to solve the case for me. It will be fun. Okay, learning can be fun. These are absolute real life situations. And the third is, of course, I would hate it to be a monolithic didactic lecture where I croak like a frog and you guys doze off over there. No way. I want it to be a dynamically interesting interactive session. So I don't care if you make mistakes. Everybody makes mistakes. I make mistakes. The idea is that after every passing year, we have to make lesser and lesser and lesser mistakes. So I don't give a damn if you feel that you are making a mistake, but I'll definitely be offended if you don't attempt. So raise your arm out, chill, you're with me, no problems, nobody's going to bite you. So whatever you feel, come out. If you have any queries in the middle of the section, just raise hand, I'll be very happy to pause and answer. This is an important point. Teaching is nothing but learning twice. So over here, I'm not here to teach. I'm also here to learn from you. So something from you, something from me makes it a good world in such a way that at the end of the next 50 minutes, let us both get mutually enriched, be better doctors, better clinicians and better human beings. All right. So first, what is the definition of the word doctor? What is the literal meaning of the word doctor? Anybody? Come on, attempt. What do you think it is? Is it a healer? Is it somebody who cures? Any idea? Take a guess, take a pot shot. Yeah. Bolo. The literal meaning of the word doctor is derived from Latin, which means to teach. So Hippocrates wanted us to be teachers. He didn't want us to be chal rahe, muh khol, pramak bin kha. No. That is a part of us. A major part is you got malaria. This is the bite. You are going to take this medicines for the next 3 days. You are going to take this medicine for the next 14 days so that you don't get a relapse. Please ask your people to fumigate the areas. See to it that there are no mosquitoes breeding. This is doctory. So let us all change our attitude. So we are not over here in our starched aprons, ki, take a shot, take an IV and go get lost. No. Once we teach a patient, have you realized what the ramifications are? Right now the society sees us as an aloof person in our own ivory towers. Ki this guy has got a Mercedes under his ass. He comes over here, he gives us a shot and he goes away. When you actually bow down and you say, no, this is the problem, this is how you're going to come across, isn't a beautiful bridge built between you and the patient? So the minute you attempt to become a teacher, half the problems are going to go away. That lack of communication, that lack of empathy which is seen as from a patient's perspective just goes away. So the first thing, the first art which has been inculcated in the science of medicine is, let us change our attitude. We are teachers. Second, primum non nocere. What does this mean? This is a Latin proverb. Come on, anybody? Yeah, you are right. Bolo. Speak up. Primum is first. Non is not. Nocere is? Yes, you guys are cracking now. So the first dictum is first do no harm. And I'm going to give you a clinical example which actually happened about 3-4 years ago. So there was a female 46-year-old. She had come for a routine medical checkup. Nothing wrong with her. Routine medical checkup. Her TMT was positive. Now first and foremost, doing TMT for a routine medical test itself, I'm a little against. Whatever, it was done and she was positive. No symptoms at any stage of life. She had no risk factors. She was not obese, there was no problem, nothing. There was no significant family history. She could walk, she could do everything, that was not a problem. But unfortunately, in the heat of the moment and by some overzealous cardiologists, her coronary angiography was done. Alright? Now, as luck would have it, the radial artery got infected. There was a thrombus over there with a huge hematoma. So this was all, bail mujhe maar sort of thing. It was so stupid. The worst is the poor lady had a stroke. So this was a huge cock up. It was something which should have been abundantly avoided. Now, there are incidents like this which you are going to see day in and day out in your clinical practice. And you realize, where the hell this will happen ever? So the first thing when you start practicing, you adopt this. First, do no harm. Was there any necessity to do a coronary angio? There was no problem. A TMT in a female is fairly normally, it can be positive for a lot of other reasons. The third is a Bayes theorem. What is a Bayes theorem? Anybody? You've learned PSM, right? So what is a Bayes theorem? This is very important. Bayes theorem says that whenever you order a test, the result is to be interpreted on the basis of the probability of the disease. Understood? So don't start ordering tests left, right and center, because every time you get a report, you might be confused. And I'll give you a beautiful example of what happened with my own case. Alright. Now this is a male who was a 60-year-old guy. He was a chronic buzzard. And during his alcoholic haze, he burnt his leg against the silencer of a motorcycle. He had severe cellulitis. So the surgeon said, "Arey khare dekh le usko," because he was a diabetic and blah blah blah. I said, fine, I'll have a look. And I gave him his medications. He was also an asthmatic. He was going to go into delirium tremens. So we gave him the usual alprazolam, whatever. IV antibiotics were going on. IV fluids were going on. Next day morning, he says that I have a little left shoulder and lower axillary pain. Alright, that's all he said. So ECG was done. There was no change over there. I was busy. And I have an over-enthusiastic registrar who sent a trop eye. So I said, why did you send it? Well, nahi sir, aisa laga, you know, high funda patient hai. I said, fine, bhejo. Now to my horror, it was strongly positive. I'm going to show you all the pics later on. It was strongly positive. What is tropi, by the way? So it was positive. Okay, the normal levels are something like 19 or 18. These guys had it in 2000. Now I was amazed because clinically I never expected it to be positive. Why the hell should he have a tropi positive? The history was not conclusive. The ECG was normal. That was a classical non-anginal pain, musculoskeletal and maybe GERD. So I said, you can't disregard a tropi like that. Eh? So I said, okay, we'll do a 2D echo. 2D echo was normal. The cardiologist was shown and he says, sir, you cannot ignore a report like it's a medico-legally damaging report. I said, I agree. I spoke to my pathologist. He's saying, no, I'm swearing that this is the right report. So we had to do a coronary angio, obviously, which was normal. Now, this is the actual report over here. See, this is crazily high. We don't know why. So his angiography was done, which was absolutely normal. As to why his tropi was positive, I yet don't know. We are going to publish a report over there, by the way. The work is being done. We are going to publish this. So the point is, sometimes all these enzymatic reactions can be erroneously erroneous. So the Bayes theorem says that it should not have been done. Because with an abnormal report, how are you going to interpret it? So this is what happens. The poor guy had to go for a coronary angio because of some stupid registrar who asked for a stupidly unwanted test. Let us all be clear about this. So I am in internal medicine and I love my branch. I am enthusiastic about internal medicine. So I am going to present a case. Let's all solve it together. Okay, this is one of those jigsaw puzzle like thing. So she is a patient who is a known hypertensive on Telma H, which is telmisartan and hydrochlorothiazide, amlodipine, vitamins, calcium since 6 months under excellent control. But lately she started getting anorexia, nausea, vomiting and severe weakness since 10-15 days or something. Detailed physical evaluations, nothing excepting listlessness. She just said, I'm tired all the time. The examinations were interrupted because of her frequent trips to bathroom because of vomiting. She was vomiting a bit to glory. I could not figure out what's wrong, and within a couple of minutes in front of me she started having seizures. The clues over here. What do you think the case is? What do you think has happened over here? Chalo, I'm giving you a clue. This is what has happened. What happens when you give a combination of telmisartan and hydrochlorothiazide? Hypo? Perfect. Superb. So this is what the lady had. And I was dumb enough to miss it. I missed it. This was just at the beginning of my career and I was more focused into maybe some sort of a gastrointestinal reflux disease or cholecystitis because she was plump, cholelithiasis, uremia, whatever. But she had hyponatremia. The sodium done was 109. So these are the sort of patients whom you have to pick up. That's the art. So medicine, you know, something like if I were to tell you guys to write an essay on infective endocarditis, you would write. You would probably get 85 to 90%. But the reverse, a person who's in front of you and you catch him to have infective endocarditis is so bloody difficult. You understand the point I'm trying to make? That is the challenge. So imagine a person who is sitting in front of you says, क्या तकलीफ होता है रे? कुछ नहीं, थकान आता है, वजन कम हो रहा है, काम करने की इच्छा नहीं है. Okay. और क्या? Physical examination, you can't find anything abnormal except maybe a little, you know, clubbing or something. Then you scratch your brains, what's wrong? You really strain your ears, कुछ नहीं मिल रहा है. So this is how infective endocarditis is in the big bad world of practice. So difficult to interpret clinically, but if you write essay, you can write. The problem is this. So the art is in developing your clinical sense in such a way that whatever you know theoretically, you have to interpret. अरे साला ये हो सकता है. That is the challenge. All right. So it's like playing a mental chess all the time with yourself. That's what internal medicine is all about. So I'm going to tell you a little story. And maybe some of you have read it. So this is a story of a hat. Okay. So this hat was left behind in Sherlock Holmes' cabin. And I think she's heard it. You know the story? So Sherlock Holmes sees the hat. And he's got a friend, Watson. So he says, Watson, what do you imagine from this hat? So Watson says, what? This is a dumb hat. What some idiot is forgotten it in your room. So he says, okay, let me have a look at him. And Sherlock Holmes looks at the hat very carefully. And he says, this hat belongs to a middle-aged person who's fat, who's obese, who doesn't exercise much, who's now very poor but was rich once upon a time. His wife has probably left him. He's got no money to keep gas in his house. He uses candle wax. He had a foresight in the past, but now he's plain dumb. And he's probably addicted to alcohol. So the Watson says, what? Are you pulling my leg or something? So sounds very far-fetched, doesn't it? But that's where the art of medicine is. So Sherlock Holmes says, no, it's plain elementary. So he takes the hat and he says, look, your hat is really big. The cranium is big. There has to be a good intellectual capacity, excepting of course he had Paget's disease. So the big cranium means that he is fairly intelligent. Look at the make of the hat. It's a hat which is fairly expensive. People are not going to purchase it. But this hat was in vogue some 3-4 years ago. That is when these guys purchased it. But he's not taken good care of the hat. It's gone to the seed. Look at the dust over there. Look at the nails. So he's now probably not in a very good financial position. He's tried to brush the hat. So his pride is a little intact even now, but not quite so. Look at the insides. It's got grayish, whitish hair. Obviously he's elderly. It's full of sweat, so which means that he's probably not in a good medical condition. He's sweating so much. He doesn't really go out. Most of the dust over here is the indoor dust. It's not the outdoor dust of London. So he's secured in the indoor house. And look at this. I see a lot of wax stains over here. So these wax stains means that there is no gas in his house. He moves up and down with candle. So this is the beauty of deduction. So one person doesn't see anything, the other person sees the sky. Now when I tell you this, it seems absolutely logical. So this is what good internal medicine should be. You know, think of the cat and go over there. So we are going to present a case right now. So this is a 27-year-old female, and she had just delivered a female baby. I am emphasizing on the word female because in our dumb society, female babies are supposed to be inferior. It is so stupid. So I saw this girl in front of me, the mother, very sad, very morose. She says that she's perennially fatigued and tired. She kept on saying, deep sighing respiration. She speaks in halting and stuttering speech. And she took a deep breath every once in a while. And she says lack of interest in everything, reduced appetite. Detailed physical evaluation was normal. You name the bloody tests and they were done. You know, all the blood x-rays, echo, stress test, USG, everything normal. In fact, they were considering psychiatrists, because they thought that this is postpartum depression. And they came to me and I said, I was all said, okay, fine. I said, okay, I'll be happy to put you across to a good psychiatrist I know. Till she said something which made my ears really go up. You know what she said? She said, sir, I'm a very passionate singer and I love to sing. But every time I try and sing the higher notes, I feel breathless. So I said, no, this is not depression. This is a genuine problem. Because anything else and everything else, I would go in for postpartum depression. But she says that I try to sing, but every time I attempt to sing higher notes, my voice fails me. So I said, okay, and I think I know what your problem is. Let's do this test tomorrow. We got that test done. We hit the bullseye. So come on, any ideas what it was? Obviously, it is nothing which can be reduced by all these things. Everything normal. Chalo, I'll be happy if somebody cracks this for me. Any idea? Any guess? Female, breathlessness, postpartum. Chalo, I'm giving you a big hint. Bolo. I don't care if you're wrong. She had primary pulmonary hypertension. So we did her CT angio and we did her HRCT, classically proven primary pulmonary hypertension. So we gave her a combination of endothelium antagonist and sildenafil. She did very well. So the thing was, you know, knowledge is not only knowledge. You have to analyze, you have to think of a solution, you have to have a right education for that, you have to have the right experience, the information, the learning, and most important is this, what we call intuition or a gut feel. Gut feel never comes without knowledge. What your eyes don't, what your mind doesn't know, your eyes will never see. So it's all together. First and foremost, you have to be well read, you have to know your theory, and then put twos and twos together like Sherlock Holmes did. That is the beauty of it all. So now we are going to come to the three aspects of medical profession. First is us, doctors over here. Second is the patient. And third is the paramedical staff. the sisters and the receptionists and the ward boys and all that. So first, and of course, this is not a single thing. They are going to have multiple branches amongst each other. So people are going to go out and gossip and say, hey, yes, this hospital like this, so that things are also there. So first, we are going to address about ourselves, as doctors. So we are going to look within. A lot of you in the immediate next 1 or 2 years are probably going to go in for post-graduation. And may I say, with all my years of practice, a lot of us probably don't find the right vocation. A lot of us go into branches which we feel are good for us or which give good Nagat Narayan, but which probably you are not born for. So some people may be born to be psychiatrists, but they become pediatricians. Some people are meant to be research people, but they end up being orthopedicians. And that's why life is a misery. So that's why my earnest desire would be, introspect, look within, find out. This is the right time for all of you guys. What do you like to do? Ask yourself, what is your calling? What do you like to do? 20, 30, 40 years down the line, what interests would you like to pursue? Which career really stimulates, puts you on? That is the sort of thing which you should be doing. And there is no such thing as a dream job. It's a myth. So you got to get about 80% of what you want, you consider yourself lucky. That's important. So this movie was really good. This movie was really good. So this is what he says. The take-home message was, don't chase success, chase excellence. Yeah, chase excellence. And the other thing is what Dr. Nagendra just told me, attitude. So you recollect that scene in the movie when this guy, uska haddi tutta hai, and he goes in front of the examiners, there's a panel of interviewers, and they ask him, what do you have? So he says, I have got an attitude. I think I'm good. So you want me to change my ideals? I'm not going to change my ideals. This is my attitude. This is me. Take your job, show it, I'm going away. So this is attitude. Now you don't have to be hedonistically egoistic and stupid, but a healthy self-respect is most important. Okay? When you fly, one of the most important messages which is given is, in case of an emergency, first secure oxygen yourself. You get better and then you are in a position to help others. In the same way, we should first secure ourselves. The biggest artistry in medicine is this. First, physician, heal thyself. So you know how pathetic things are? The amount of stresses which we face are amazing. Right now, a doctor goes through a hell of a lot of stress. Addictions are crazy. Doctors probably have one of the highest rates of addiction to smoking, to drinking, to substance abuse or whatever. The divorce rates are sky high, and the amount of psychiatric referrals and suicides in doctors is appalling. And this is not a new phenomena. Even when I was a student, at least 7 to 8 batchmates of mine have perished. Suicide, self-harm, whatever. So things are that bad. So how do we avoid that? So we have to create a very good personal space for ourselves, and that is most artistically altruistic. Unless and until you are healthy yourself, what are you going to dispel health about? So we are in the health business. If you are not happy, you cannot give happiness to others, So first, physical fitness. How many of you exercise on a regular basis? Come on, hands up. It should be a lot better than that. Should be a lot better than that. So unless until we ourselves exercise, we have no right to tell other people to exercise. Emotional and mental health, very important. So we have to be healthy ourselves. Relationships. About 40 years down the line, you recollect my words. Today is 27th of October 2018. You will realize some 40 years down the line, you might all be very affluent. You might all be very, luxuriously well placed. But the vacuum which we will feel in our lives because of poor relationships will be absolutely damaging. So let's now go a little easy on our own professions if necessary. Build very good relationships. Hobbies are too interesting, unless and until you have a good hobby, you'll be a dry person with nothing to talk about. Traveling, I'll be talking about later on. Reading, movies, socializing, having pets. Have you read a latest report? It said that every time a puppy or a dog looks at you and licks you, what happens? What happens? You start feeling so nice, oh, so sweet. So what is the biochemical basis of this? Yes, which one? Which one? Oxytocin. So every time you are in love, every time you look at a puppy, every time you see a baby, every time you see something good, you release oxytocin, which is a feel good hormone. All right, so that's how important pets are. And most important is me time. This time is for me, not for my patients, not for nothing. So a person has two hands, one is to help himself and the other is for helping others. Emotional intelligence is so important. We talk about IQ. What about EQ? IQ is the hardware, EQ is the software. So you might be very intelligent and you will come and tell a patient, you have bronchial carcinoma, stage 3, metastasis to the lungs, you're going to die. So you got a good IQ, but what about the EQ? Your patient will clobber you up and he'll go out and say, don't ever go to that idiot, he doesn't have the bole ki tamiz nahi hai sale ko. So this is what happens. So I have had colleagues like these who might be brilliant, but look at the way they talk here and look at the way they conduct themselves. So emotional quotient is so important. Can you develop a good emotional quotient? Are you born with it or can you develop it also? Both. So one of the most important thing is by reading. I'm going to flash some books over here. I will be happy if all of you have read it. If not, they are highly recommended. Have you read this? Mario Puzo, Godfather, do read it. Fountainhead, Ayn Rand, never to be missed. The Citadel by A.J. Cronin, don't ever miss it. Sherlock Holmes, all the books for the sheer logic of human bondage by Somerset Maugham. Doctors by Eric Segal. Complications by Atul Gawande. Jonathan Livingston Seagull. All these are superb books. Once you read these books, your fundas will be clear, your life will be better. Traveling is so important. How many of you have really traveled? Excepting, going to this place or that place. So when you are really out of it, when you can start affording your own these things, do travel. You don't have to travel to Mexico or to Argentina. No. Start local travels. Then as your purse allows, go a little farther. But there is nothing like traveling which is going to make you smart. For the simple reason that is that interaction, and like you had an IQ, you have an EQ, and the third thing is a social quotient, SQ. So the more different people you meet, the more interactions you have, the better you are going to be. This is one thing again which is so important. If you want to converse with people, if you want to commit communication, traveling is important. Developing a foresight is so important. You might have knowledge, but the ability to look into the future and predict, look, this is what is happening right now, but I fear ye ho sakta hai. Yeah, no, you're going to be okay. I'm telling you right now, that ability to see afar, that comes out of a lifetime of practice. You're not endowed with it. And for that, we have to work our backsides off. Okay? And of course, the necessary evil, your colleagues, you cannot do without them. So a lot of you are in the same batch. Maybe 10 years down the line, maybe she'll be a physician and she'll be a gynecologist, or she'll be an orthopedician and he might be his anesthetist. So you're all going to interact with each other, maybe. Now, I'm going to give you some artistic do's and don'ts about how to deal with your colleagues. It's so important, okay? So the first thing is you have to be together. As of 2018, in front of the patients, we have to be together as a medical community. We have to be on the same page. So if one guy says operation chahiye, and then anesthetist says, yeah, kisne bola operation, kyun karta hai operation, gaya. So how we speak, we have to speak in one language, and the feedback is so important. Like if I am referred a patient by my surgical colleague, I give him a call and tell him, look, I feel this is this, this is this, this is this, you hold your aspirin, hold your low molecular weights, or this is the insulin I want to give. This close bonds between us practitioners is so important, and this is a thing which we should never do. What is this? Slander, loose talk, backstabbing, criticizing your colleagues. Stupidly stupid. It's going to get us all into trouble. It is going to get us all into trouble, because a lot of medical legal cases, they go against a particular doctor because a particular doctor has spewed venom into the eyes, into the ears of that patient. Why was this surgery done? It was not required at all. What can you do? Or, arey, oh my God, this medication, oh my God. So, and the worst, most damaging is कि मेरे को देखने का भी नहीं है. I have seen people behave like this. So, it is one of the most damaging things to do. Don't ever do that, because today you are doing it, day after tomorrow you might be the victim of somebody else doing it. So, best is you don't do it yourself. We have talked about our science and we have talked about commerce, arts. What about commerce? This is the third stream. We cannot do without it. We doctors earn so late. We earn a lot, not a problem, but we earn in our early 30s, mid 30s. We really hit the peak somewhere early 40s or maybe mid 40s. Whereas an engineer starts earning from age 23, a chartered accountant from age 22. Models, so they start earning from age 16 onwards. But we are not models, unfortunately. So we never think about medical financial investments, and unless and until we are really professionally very well off, we will not think of doing good work. Once we apna roti kapda makan is secure, we know, okay, this is a good way and I'm going to stick to my principles or something. But if you are not really making good money, we are going to get tempted, there's no doubt. So right from the first time that you start earning money, start imagining how to invest. The whole beauty is first you work for the money and then you make the money work for you. So 0 to 1 you are going to make, but 1 to 10 let some smart chartered accountant or financial analyst or some professional guy whom you trust take over. There is nothing lost in being aware of money. You don't have to be greedy, but you don't have to necessarily forsake your fees either. We have to be honest, we have to be ethical, but we don't have to be necessarily dumb. We can't let people take us for granted. And I don't at least appreciate poverty. Money is good, but it should be honestly and decently earned. The problem which I have been seeing is people who have been my students for the last 25 years I've been teaching. So people suddenly start going out into the big bad world of medicine. They want it all. They want to start with a Toyota. They want to start with an iPhone X. They want to start with an air-conditioned clinic with a pretty receptionist. So what happens is the overheads, they start mounting. And then when you can't afford to give the returns, then that devil comes over here. Isko 40% do, जरूरत नहीं है तो ऑपरेशन अपेंडिक्स निकाल दो. So best is start slow, grow fast. You are going to get your iPhone XS, you are going to get your luxury travels, you are going to see the world, I am telling you. But let's be a little slow and steady about it. Let's grow slowly, that's important. One of the most important things which I would like to convey over here as an art and science of medicine is humility. So humility is not thinking less of yourself, but it's thinking of yourself a little less. Let's give a little more thought, because a person who is more important is the patient. The patient has come to you. So let us be humble. The feet have to be on the ground and very decently, politely. It's a very less known fact, but a lot of medical legal cases are not really put up because the doctor is incompetent, but because the doctor has been rude. The doctor has not communicated properly. The doctor has not bothered to explain things properly. He has been brusque. He tells, ask that guy. Hey, isko bol rahe kya karne ka hai? So this is what the patients remember. A lot of medical legal complications are because of bad behavior, not because of bad medicine. So please understand that very well. We are in a profession where fortunately or unfortunately we have to keep reading. We have to keep upgrading ourselves. We have to keep, so a garage mechanic is not plagued with this problem, but we have. So reading all the time, upgrading yourselves all the time, attending seminars, interacting, it's a must. Unless and until you have this art of really upgrading yourself or wanting to upgrade yourself, progress is severely curtailed. There's no doubt about it. Now let's come to the second aspect. So we have talked about of the three, that is the patient, the doctor and the paramedical staff. We have covered ourselves, the doctors. Now we are going to talk about the patient. So just like I asked you what does the word doctor mean, I'm going to ask you what does the word patient mean. Any idea? Is that a patient who lies down in front of you and he keeps groaning on you all the whole day? Is that a word? Is that what is meant? The literal meaning of the word patient. Any idea? It's a Latin. It's been derived. The word patient has been derived from Latin, which says one who suffers without complaining. One who suffers without complaining. So it's there's a very pathetic tinge to it. Poor guy, he's had to come to you because he's suffering. So let us change our perspective. A person who comes in front of you, the minute, and I have seen some some doctors, the minute a patient comes, it's like a cash register, ting ting, tak tak. They have this dollar sign over there. That tongue comes out, Are bakra aaya. No. A patient is not somebody like that who gets off your cash system. A patient is somebody who's a poor soul and who's come to you seeking help. So when you listen to the patient, there are three golden rules. Absolutely artistic things. Unless and until you have this art in science, you're going to be failures. First is most important. Listen. And by listen, I don't only mean listen by ears. Soak that person up. Understand what is the psyche, what is he all about, how passionate is he about describing himself, what sort of a misery is he in, what status is he in, who's accompanying him, everything. The most second important thing is to be polite. I have already said that. So you can't interrupt the patient. Okay, I got it. No. Many a times patients feel better by just ventilating, by just listening. I know we don't have too much time over there, but then that's the art of getting the right information, at the same time not letting the patient know that you're cutting him or her off. Ask the right questions, shepherd the patient in the right direction, at the same time give hints, okay, fine, I know what I want, let's come to this direction. So this interviewing is nothing but an art. You will get it. You have to develop it. And the third and the most important thing is about this. You have to convince the patient to follow instructions. So this is an art in itself. How to sell yourself to the patient. How to sell yourself to the patient saying that I know what the problem is, I am going to get you right, just stay with me. I am there for you, I am competent, I know what I am doing with your body language, your intonation, your speech has to show him that I am in safe hands. And then the patient is going to follow orders. And this is so important, the golden balance. How to be friendly but not to be too friendly. नहीं तो सर के ऊपर बैठता है दिन भर 50 WhatsApp भेजेगा. We don't want that. We don't want a lady patient flirting with you. That happens a lot of times. Worse, we don't want a boyfriend flirting with a male doctor. That also happens in 2018. So we have to have that polite thing. We have to give him assurance that you are going to be okay, but we don't want to give him absolute unconditional statement that I'm going to cure you. That's also we don't want. So this is an art of how to say, how to communicate without trapping yourself. That's important. Read this book if you haven't already. How to read a person like a book. This is an excellent book which actually tells you how to understand the body language, how to understand the gestures, how to interpret a person who is in front of you. Not only the person who's with him. If there are 4 people, a practiced doctor who's got art over here will be able to tell you in 2 minutes. कि साला कौन पेस मेकर है यहाँ पे, कौन खिटखिट करने वाला है, who is the main person, ये उसको डरता है क्या, या फिर this person is a pain, this person is a poison. We know everything, So I'm going to tell you a little story. I had a 24-year-old guy, type 1 diabetes. Girish, this is what I meant. I wanted it coming one by one. Anyway, so there was a type 1 diabetic person, and he was taking 2 shots of 30/70 and 1 of rapid before lunch. Ever increasing insulin requirements. Sugars were crazy. Absolutely non-compliance. Father threatened to disinherit him. Unless until you go to Dr. Khare, I'm going to disinherit you. So he came to me jhak maar ke. About 14 days before coming to me, he started putting his act together, and he gave me a sugar of 89 and 123. The father was very happy, but I caught him because his HbA1c was 11. So what does this indicate? How do you interpret these two? Sugars are normal, but the fast HbA1c is 11. So yeah, bolo. Speak up. How do you interpret this report? So the previous reports were lousy. In the last 10 to 15 days, this guy has been poking himself insulin regularly. When I asked him, why are you doing this? There was something about him, he was very shifty. He was a high class person with a lot of money to his credit. And I told his father to just go out, I want to have a talk with him. The father was very grateful. I said, please speak to him. I attacked him immediately. I just frontally attacked him. I said, look, something, I think there is some sort of an addiction. So he says, yeah, I smoke pot. So he was hitting marijuana. By the way, how frequent is this pot and marijuana here in Hyderabad? Even I was surprised. Sometimes I feel I'm backward. So I have had people from 12th standard and first and second standard smoking pot. It's routinely available outside schools and outside colleges. Yahan pe it's that bad? You've seen. So he used to smoke pot, and I immediately sent him to a psychiatrist. And after the psychiatrist, he had definitely psychiatric problems, and because of substance abuse, he was going more and more into psychosis. So my friend told me कि खरे मैं पहले उसको risperidone and Serenase देने वाला हूँ. I said please दे दो उसको. So he was put on risperidone 1 milligram once a day, Serenase 6 drops morning, 6 drops evening. Within 24 days, the next time he came to me, I could see sense in his eyes. So he says, now I'm better. Then he started adhering to his medication. So the problem was not diabetes. Problem was addiction and psychosis. So that is how interpreting a person is so important. Communication. I would probably feel, I don't know, both of you should agree with me. We should be including a chapter or a subject called communication skills in 3rd MBBS level. We were never taught communication skills. That's so important. When you're actually in the big bad world of medicine, you realize how important it is to communicate to people. We think that we are speaking to people, but how much are the people understanding? How much do the people understand the gravity of the situation? What is the doctor trying to say? So it's all about how to see to it that you are communicating something and get a receipt. Yes, I think he knows what I'm talking about. So communication skills are very important. So this was a 19-year-old merchant navy student, and I remember this very clearly because I was partially responsible for this. That time I think I was a lecturer, and I had just become a lecturer, and there was this guy who had come to me for medical fitness for going to some merchant navy course. Routine pre-employment checkup, and he had a loud systolic click with a grade 2 systolic murmur. All right, he had classical Marfanoid features, tall, huge arm span, upper this thing and all that, and with this sort of a thing. So what is the diagnosis? Marfan's with what? What is the lesion? MR with what? Because of what? Mitral valve prolapse. He had a classical click, mitral valve prolapse tha usko. So what I did was, I had a lot of students with me. I said, okay, fine, I'll just teach you what a mitral valve prolapse and Marfan's is. I spoke to that guy very nicely, and then we did a 2D echo. It was showing MVP. So what happened was, after that, I spoke to that guy nicely. I said, look, there's no problem. You can go for a merchant navy course. I'm making you fit. But unfortunately, those over-enthusiastic medical students, you know how we have all been when we were 21, 22. Arey kuch acha mila, chalo dekho, tu bhi aa, arey isko bhi aao. So 50 people उसको पकड़ के नंगा किया, ये स्टेथो लगा रहा है, ये स्टेथो लगा रहा है, कोई बोलता है ये करो, कोई बोलता है पुशअप्स करो, ये करो, you know how that guy became a nervous wreck, yaar. Honestly, the next I hear about it, when I was maybe some 6 months ago or something, he just withered away. उसको लगा कि कुछ बहुत बड़ा प्रॉब्लम हुआ है. So he became a mental wreck. So of course, this was not only our problem. He had an innate disposition also for anxiety, but it depends upon how things are communicated to him and how we, unfortunately, unartistically, we do damage to people. Patients' relatives, you know, the biggest pain in the are patients' relatives. I always tell I have got 3 assistants with me, and I tell them, patient को मैं संभालूंगा, रिश्तेदारों को हम 4 लोग संभालेंगे. Because patient लड़क गया तो वो कुछ नहीं करने वाला है रे, पीछे से ये लगाने वाले हैं. So the most important thing in the world is to handle the patient's relatives very well. So every time what I do is I take special care, special time off to explain to the patient along with the relative, because I don't have the patient all the time to report everything to him. So this is very important. First 2 or 3 things, and at my level of practice, I get patients who have been seen by 7, 8, 9 physicians. Then they come to me. My appointments are not available for 2 to 3 months. So I, fortunately or unfortunately, get the most complicated patients. By the time they are fed up, and like, you know, I can't make mistakes. So I have to be very careful with them. First, identify ये साला 4-5 लोग दिख रहे हैं, उसमें से pacemaker कौन है? Who is the pacemaker of these 2? वो चला क्या करता है, उसको पहले पकड़ने का. हाँ, excellent. अरे यहाँ पे, so then उसको बोलो, you know, what's your name? Asha. Who are you? I'm his daughter. Excellent, Asha. What would you do, Asha? I'm a computer designer. Oh, lovely. So Asha, एक काम करना, you know, you have to understand things. You are the brightest of the lot. This is, oh yeah. So I said, मैं काम करने वाला हूँ. I'm going to deal with you. Okay. I can't keep dealing with 14 people. So unfortunately, your father is not doing too well. He is going to be in the hospital for a long time. You know the case. Your file is this big. I'm going to try my best, but you be my point of contact. So I'll tell you, and you are going to relay all the information to others. By the time Asha is full, yes sir, neutralize the most potent person. You have to first neutralize. So this is the art, this is shrewdness. You call it deviousness, you call it worldly wiseness, whatever, it has to be done. So these are the key makers whom you have to really identify. Now let us get into the patient's psyche. Like for example, imagine that you were a patient and you have to come to me. You don't like my thobra yaar, but you have to come to me. What are you going to do about it? So what are your concerns? in 2018, the most important concern is time. Believe it, time. My pediatricians friends tell me कि खरे सबसे बड़ा खटखट रहता है वो patient नहीं, उसके माँ बाप. Because in Mumbai almost everybody is working. Mother and father both are working. बच्चे को बुखार आया तो they go to a pediatrician. The pediatrician says, a well-meaning pediatrician, like suppose somebody like me, he's going to say, look, this is viral fever, give him paracetamol, 3, 4, 5 days, it's going to go away. I'm not going to give antibiotics, I'm not going to give antimalarials, no tests are required, just sit tight. Right advice, but how many people in Mumbai or in any of the Indian metropolis are going to have the time to sit at home for 5 days? Sad situation. So what they do is, they go to an idiot who gives nimesulide and ibupara and voverans. तो बच्चे का बुखार एक दिन में जाता है, but at what cost? But he is a good doctor because उसने एक दिन में मेरे बच्चे को क्योर किया. See the fallacy. So understand the patient's psyche. So this is the time. So if you explain to the patient, if they are sensible, they'll listen to it. Finance is a terrific problem. You know how commercially burdensome it is to fall ill nowadays. All these corporate hospitals, very expensive. We'll talk about it later on. Actual hands-on problem, like I am admitted over here, घर में कौन चक्कर रहा है? That बाई आके जा रही है, बच्चों को डब्बा नहीं मिल रहा है. The mother-in-law is cackling over there because her insulin shots are not being given. All sorts of hands-on problem. Pain and discomfort is always there. And the most important thing, stress, anxiety and uncertainty. What do I have? Am I going to be okay? Because they have this Miss Google with them. So they are going to publish this ki lymph node in the right axilla, they get 10,000 differential diagnosis. They don't look upon Kikuchi's disease, they don't look after infectious mononucleosis, which is very common. They are going to pakad up, they are going to catch tuberculosis, they are going to catch malignancy, they are going to catch Hodgkin's lymphoma, and they are going to chew your brains. So the anxiety and the stress of a patient is amazing. And that's why this Hippocrates, cure sometimes, treat often, comfort always. So comfort has to be from your gestures, from your medications, from the way you talk, from the way you convince. It's your body language. It is how you radiate warmth and affection and hope without being stupidly optimistic. So that's some golden thing. Simple touching a patient, with kindness. Have you ever, when you actually become clinicians, you realize, so simple, just go and keep a hand on the patient's back. How are you feeling? Are you better today? He'll just crack into a smile, his life is made. So a good, healthy touch itself is worth some 10,000 bucks. So my take is, whenever I have a complicated patient, first I ask them, do you have a doctor in the family? So if he says yes, मेरा काम बहुत आसान हो जाता है. I said, okay, come, I'll teach you in medical things, explain everything in details, tell him this is my working diagnosis, I'm not sure, but this is what I'm working at. This is the prognosis, expected course of illness, how long is the expected illness going to last, and keep on sensing, probing all the time, what is going on in their mind, are they happy, are they satisfied, what is the thing. And then I am going to tell them, this is this is the report. I'll be happy if you want to take a second, third, fourth, 36th, 108th opinion. I am not claiming that I know everything. I am not God. I am a human being. But this is my working as of today, 25th of October 2018. Right now, if you have any the problems, take another opinion and enlighten me. I am with that doctor. I don't have an ego कि मेरे को सब आता है. No. But tell me right now, you are not going to wait for 2 weeks and then with a hindsight, some idiot says, अरे खरे ने ऐसा क्यों नहीं किया 2 हफ्ते के पहले? No. Do it now, not after 2 weeks. So with this sort of a thing, most of them get called off, that's the better thing. The third aspect of our profession, first is we ourselves, second the patient, and third, this scares me like anything because this is where I can't control. These are the physiotherapists, the nurses, the lab technicians, the TPA people, the receptionists and all that. You have no control over them, and that is what is really dangerous, So from the hospital end, the problem is TPA and insurance. You have to be so artful when you deal with it. Have you ever dealt with any of your relatives who was admitted recently in a big hospital and who's got an insurance done? It's a nightmare. So first you have to go over there, get a sanction from the insurance company, get it done. They are going to ask you 1000 questions. Jarurat kya hai? Why this room? Why this doctor? Why this antibiotic? On top of that, when it comes to discharge, I have had a patient who's gone home 16 hours after I have discharged. 16 hours. Because that is the time the TPA comes to wave it off and all that. Okay? You might have busy, rude or brusque nurses. The tragedy is, and this is human nature, when a person goes home successfully, he may not remember that Dr. Khare treated me out of septicemia. I was in a lousy condition. What he'll say is कि देख कितना मेरे को लगाया, देख कितना बड़ा infection हो गया, thrombophlebitis हो गया. और I was so hungry, I asked that doctor to whether he'll give me food. The doctor said, go to that nurse. That nurse didn't even look at me. So this is something which they are going to tell to 25,000 relatives. So this is human nature. What are you going to do about it? Procedural delays. This is pathetic, but this is what happens a lot of times. You want a sonography done, but the sonologist is not there, or the person has had food, you cannot do a sonography. So you get blamed for problems which are not yours. Reports. All sorts of reports are there, but unfortunately they have not been printed or they have not been released. Thrombophlebitis, I've already said. Medical bills are a huge problem. A simple thing like, a simple piles or a surgery or hernia or hydrocele doesn't cost you less than 50,000, 75,000 bucks. Normal delivery is 50,000 plus. Caesar is 1,25,000 plus. Am I right? So these are the figures which you are talking about. So medical bills are a problem. Now the interpretations of the reports and of the situation. Now these two cases which I am going to show are one of my last two slides. This is really interesting because this is all what is art and this thing. So I had a 56-year-old male patient. He was from Merchant Navy. I want all of you to help me solve this case. I want you to, because this is very interesting. He had diabetes, hypertension, dyslipidemia, and he had OPCA, which is olivopontocerebellar atrophy. So he was like this, the cerebellar involvement. He had nystagmus. He couldn't see properly. He walked like that. So very bad situation. He was living hell because at the age of 55, when he was really productive, the poor fellow had all this. He had to be confined to the house. Suddenly, about 1.5 years after this problem, he started getting breathless, very gradually. He says previously the physiotherapist used to make me talk, I used to work, but now I cannot walk anymore. All sorts of tests were done, X-ray, echo, serum chemistry, everything was done. So the doctor who was treating him for about 1.5 years, she said, give diuretics. So why diuretics? Nothing, but it was given. So he deteriorated even more. He came to me, I caught the diagnosis on physical evaluation. He was grossly pale. Can you believe it? His hemoglobin couldn't have been more than 8 or 9 or something. And the breathlessness was because of anemia. It had nothing to do with all his heart and X-rays and metabolic parameters and all that. All the pertinent tests for anemia, stool occult blood negative, OGD-scopy negative, electrophoresis negative. I am wondering, Coombs test negative. I said, why the heck should his hemoglobin fall? Why the heck should it fall? There was no answer. Till I thought from the relatives' perspective, there was a huge crowd in my clinic that day. I said, no, there's something very interesting. So I told him, just get out, let me think about it. I said, okay, I see a person over here who's been suffering for something like 15 months. What would the relative do? He's fed up after going from this doctor to that doctor. So tell me something, all of you, if you were in this situation, what would you do for a impossible to cure condition like OPCA? What would you guys have done? What would, okay, forget about you, forget about a non-medical family. What would they have done in utter desperation? And something which is going to correlate with anemia. Think. So we are talking about art and science of medicine. It takes an artistic mind to think of a scientific solution. So I thought about it and I said, okay, this is what a normal person would do and this fits my diagnosis. So I called the lady over. I said, have you been doing this? It was. Ayurvedic medicines were being given. Now I've given you a clue. What is the diagnosis? So this is that person's report. Hemoglobin is 8.2. Everything else is normal. So he has a selective anemia without anything. This was the diagnosis. What is this? Lead poisoning. I thought it had to be that because there was no other option. A person is losing blood, I mean the hemoglobin. It has to be Ayurvedic medicines and which is rich in iron, so rich in lead. So we proved that this is lead poisoning. And then what I did was I had it analyzed. Okay, let us not leave anything to the mind. the powder she had, we analyzed it from Kalina University, which was rich. So normal intake should have been this much. This guy's levels were this much, amazingly high. So we admitted him in Apollo. I gave him Saximer and he was absolutely fine. So this is how you have to think about it. This is another situation. So the first, and how do you interpret the reports? Either by the situation or by this. This is another case. This is my last case. 34-year-old lecturer in a city college, chronic nagging abdominal pain. History wise, everything normal. Physical evaluation, normal. Taken loads of medications. Fear was flitting from doctor to doctor with no relief. So I just chatted her up. I said, no, there's something wrong. I said, okay, yahan ka baat, wahan ka baat. During that conversation, I said, okay, how many relatives do you have? I said, one doctor. I have one sister in Canada or something, but USA, and she's not doing badly. She's not doing well. She has a CA colon. So I said, acha. So I said, how come she has CA colon? I said, I don't know. She had it and all that. She initially refused, and later she said, ki yes, she's been stressed with the what if factor. Ki mere ko to nahi hai CA cancer, CA colon. So what is the solution for this? I offered her the solution, she took it and she got better within 30 minutes. So what was the solution? Sorry? Placebo. She was a fairly intelligent person. She was a lecturer, and what I sensed about her was she is intelligent. Her fears had to be settled. So I did a CCT, I did a CT scan of the abdomen. उसको मैंने बोल के रखा कि तेरा normal आएगा पर तू करवा लो. Because this is the ultimate in malignancy. If you have any doubt, we are going to get a scopy done, but मैं तेरे को बोलता हूँ negative आएगा. The minute she saw the negative scan, she was off. So she gave me a call at all saying, Doctor, I'm absolutely okay. You are right. It was that anxiety which was causing abdominal pain. So this is how you interpret. So at the end of the talk, you know, medicine is a science, but which has to be practiced artistically. Otherwise, there's no sense. It becomes a very dry and drab thing, you know. And then at the end of our medical careers, we can't grouch here. Yeah, we tried our best, but we didn't make it. So fate is what you are given. But what you make of your fate is what your destiny is. So I hope all of you have a glorious destiny in front of you. Thank you so much for the patient listening.